Welcome back. I am back now from Jackson, Wyoming, where I had fun skiing and definitely used that recovery squat that we went over last week. Now we're going to return to the low back and talk a little bit more about low back pain. We discussed earlier about central low back when it's just right in the middle, but most of the time we get pain that is either on one side or the other. And as I mentioned before, you want to make sure that there are no organ issues like your kidneys referring pain to your low back. So just make sure that there's nothing going on with your primary care doctor. And then we can look at why would you have low back pain that's on one side versus another. So we're going to talk a little bit about some of the habits that may contribute to it. First, I want to talk about this week is what causes or what contributes to our pelvis being out of position that causes the low back pain. So if you think about what we discussed before, that if our pelvis is tipped forward, that causes our muscles in our low back to kick in more so than if your pelvis is just in neutral. The other thing that we have to consider is that we're not symmetrical on the inside with our muscles. So our right hip flexors attach a little higher on the spine, and that contributes to a little bit of a torque. So our body is set up to be asymmetrical in our trunk, and that affects the rest of our body. Now, if these muscles are pulling a little bit and we're torqued sideways, and if we have a tendency to stand on our right leg, our right low back muscles might work a little bit more than your left side. If over time this happens over and over and we don't get out of that certain pattern, our pelvis gets a little bit torqued. And when our pelvis gets torqued, it becomes hard for us to even realize it because we have the most amazing ability to adjust to whatever situation we're in. When that happens, the muscles learn to stay contracted on one side, like let's say your right side, or if you've had compensations, your left side might also be contracted. But just know that if it's on one side versus another, and if it's not central to your low back, that means certain muscles are overactive on that side. Now, we're not even going into scoliosis yet because that's a whole nother ball game, but just know that when you have low back pain that's on one side or another, that means there is something off in terms of your muscle pull, and your pelvis is not tipped forward equally. One side might be tipped more than the other, or the opposite way, or one side's tipped more than the other, and then there's compensation. So sometimes it takes a little bit of teasing apart to figure out exactly what's going on. But I just want to get you introduced to the concept, and we'll talk about some habits in the next episode that contribute to why you might have one-sided pain versus the other. I hope this helps. If you have any questions, please reach out to me. Go ahead and go to paberinstitute.com to learn more about what I do and how I can help. Talk to you later. Bye.